We have been looking at patients who would have recovered from COVID but are now experiencing prolonged symptoms. And because of how many persons have recovered and we've been hearing different things, what we are now in the process of organizing is a multidisciplinary team to provide care for long COVID patients.
That was Minister of Health Dr. Frank Anthony during his daily COVID-19 update. Long COVID is described as symptoms continuing for more than 12 weeks after an infection, severe or mild, which can't be explained by another cause. Some of the symptoms include extreme tiredness, shortness of breath, chest pains or tightness, and problems with memory and concentration. Based on scientific studies, 10% to 30% of persons who were infected with COVID-19 suffer from long COVID. While it is unclear how many of the more than 23,000 persons who have recovered from COVID-19 locally fall into this category of long haulers, the minister divulged that locally the health sector continues to see multiple cases. Dr. Anthony explained that the unit will be multidisciplinary since the effects of COVID-19 affect almost every organ in the human body.
This is going to be a multidisciplinary team because what we're seeing with COVID, it can affect any one of the organs in the body or sometimes several organs of the body simultaneously, and therefore you need this multidisciplinary team to assist in the management of some of these patients.
While the first unit will be based at the Georgetown Public Hospital, it is expected that similar units will be established across the country.
And we will then be able to replicate that to some of our other regional hospitals, depending on the patient load that we'll see. So we are working with the doctors at the hospital to set this up.
Since the unit is now being formulated when persons are discharged after being treated for COVID-19 at a government institution, they will continue to benefit from follow-ups where clinic will be recommended for them to visit to ensure they recover well, the minister said. In recent months, this newscast has highlighted the plight of a number of local long haulers who are struggling to cope with the debilitating effects of the disease long after they recovered. One such person is Nia Suban, well-known actor, author, and journalist, who during an exclusive interview with Nightly News in June, detailed that more than a year after recovering, he continues to experience a daily, debilitating array of symptoms which include shortness of breath, difficulty sleeping at night, and inability to fully utilize one of his arms. Simple everyday tasks like climbing the stairs has become a grueling challenge for him. This is as a result of body aches and difficulty breathing.
The actual difficulty sometimes, I would say, in breathing. I don't have to have an aid to breathe, thankfully, but I know there are times when I have to really push harder, and that wasn't happening before.
Meanwhile, with regards to the ongoing vaccination drive for the adolescent population, it was reported that 951 adolescents were vaccinated on Wednesday, increasing the vaccination total to 4,662. Minister Anthony noted that the ministry is building capacity in every region to ensure every eligible adolescent access the vaccine. With regards to vaccination among the adult population, as of Wednesday, 316,973 persons, or 61.8% of the adult population, had received a first dose of a COVID-19 vaccine. 165,401 persons, or 32.2% of the population, is now fully immunized. Reporting for the HDP Nightly News, Kendell Richmond.